Mrs. Bernard. I'm Dr. Smith. I'm one of the surgeons on the surgery team that is going to take care of Warren. I know that you're aware that he has a very serious case of meningitis. And what we're concerned about is some purple areas that are on his skin, particularly in his leg, as well as some of his fingers. And that means that those areas aren't getting enough oxygen, which is called necrosis, or actually where the tissue has died. Unfortunately, we need to basically remove the dead tissues, and that means amputation of the lower part of his leg and those 2 fingers. This is a very difficult decision. He is a minor, and he's heavily medicated and intubated, and so you are the one that has to make that decision. I've brought back in Amy to help you and help us talk through this decision and offer some advice.
I understand how difficult this is for you, and Warren is so young, but I want you to know that you're not by yourself. We're here as the team's going to help you, and you have such a good support system that we talked about earlier, and we can call in your family and friends to come in as well. But unfortunately, because Warren is 16 and you're his guardian, you would have to make this decision.
What happens if we don't do the surgery?
So because those areas have died, that area can essentially spread to others. Also, we're trying to save his life. That's our goal, and to prevent as many complications as possible.
I just don't see how we can do this. He's an athlete. How can I make this decision for him?
I want you to think about this. If a friend had to make this decision for their child, how would you be supportive for your friend? What would you tell your friend? Your friend's such a good mother and a caring for her son, but you want to save his life. And unfortunately, this is the only option we're working on surviving.
And with a great team of professionals that are here, they can help through the rehabilitation process. They can also work on getting prosthesis as well as some other options to improve Warren's mobility over time.
Eventually, he will transition. When he gets through this acute phase, he will transition to a rehab facility. But I will work with you. I will be with you through this whole process.
So I have to make this decision? What do I tell him?
We will work together in telling him. We will work with the psychiatrist, me, you, and any other family member, and the physician will work together in telling him. There's no denying he'll be upset, but it will be a process, and it'll be a new baseline that we can work with Warren. But he'll still be with us. That's the goal, is for him to survive.